Hi there. My name is Dr. Michael Wald, and I'm the Director of Nutritional Services at a holistic medical center in Westchester, New York, Integrated Medicine of Mount Kisco. I have a few different board certifications in nutrition and also hold a master's degree, and I'm a dietitian nutritionist. This is Mr. Sonny Seward, who is a certified nutritional specialist with a master's degree in nutrition. And we work together with a variety of patients here in the clinic, and we're sitting down right now going through what we call a Q&A, which is a series of questions that are either true and false questions or multiple choice questions. However, Sonny would like to mix them up to make this a bit more entertaining for you. If you have further questions for us regarding what we're speaking about today, feel free to call us at our office at 914-242-8844, or you can send us questions in the form of an email by going to our website at www.intmedny.com. Sonny, shoot away.
Okay, so the topic of our Q&A today is toxicity.
Right, toxicity.
Okay, so Dr. Ward, the first question, does the regular blood work your doctors order screen for toxicity?
Unfortunately, Sonny, no, not usually. Unless you go to your doctor and you say, Doc, I need you to check me for mercury. And many of you have done this because we've seen these patients before, and then their doctors reluctantly check, and sometimes the mercury comes out high, and then the patient says, very enthusiastically, okay, well, what are we going to do about that? And the doctor says, I have no idea. How often have we heard this?
Yes.
So the answer to the question is no, doctors do not generally check for toxicity. If they actually expected toxicity in a given patient, they would refer that person either to the ER or possibly to a toxicologist. The issue with toxicity is that, depending on the toxin, any number of symptoms can show up, from fatigue to skin issues to immune problems, cancers, chronic diseases of a variety of causes, which go unrecognized for many months at the least, to many years, to actually even decades. Wow. So we do have our own toxic panels, but even those panels should be based upon the greatest likelihood that a person's total health issues and the way that we've assessed them sort of directs us to those panels. There are tens of thousands of toxins, so we can't have just one panel.
Understandable. Could you explain a little bit more about these comprehensive testing panels?
Right. So there are companies that provide kits that check various toxin panels, but we recommend them only after a thorough conversation with the person and looking at a variety of standard laboratory work like comprehensive blood counts and chemistries, for example, because depending on abnormalities, depending on the diagnosis someone's been given, depending on their symptoms, issues, and other factors, that helps direct us to what toxin or toxins that we want to test in a person. So again, there's just no way of having a comprehensive toxin panel. They're always limited to whatever they're limited to. Mm-hmm. That's why an individual with a brain, hopefully one of us or both of us, would have to look and speak with an individual to determine what toxic testing they would need. And then the right sort of panels need to be checked. Let me talk a little bit about that, Sonny. You know, there are tests, for example, to check mercury. Again, just as one toxin example. Mercury can be checked in the urine. It can be checked in a red blood cell membrane that covers the lining of cells, and it can be checked in the plasma or serum of someone's blood. Now, a red blood cell membrane is supposed to reflect the membranes of other cells in the body, and plasma is the fluid around the cells or the tissues, and then the urine, obviously, is what is being excreted from the body. So I've heard even practitioners and well-respected ones say, well, the best test for mercury or toxin testing or at all is, let's say, the urine. But as you can see, just based on the simple explanation I just gave, is that a toxin, for example, mercury, can hide or sequester itself in a variety of tissues. And unless you check maybe at least those three, red blood cell membrane, like storage in a tissue, urine, which is excretion, and plasma or serum that is in transit, you can't know. By checking all three, in this case, you can know if your detox efforts are working and where this toxin, in this case, once again, mercury, is hiding out. And the same is true for a variety of other toxins. You have to look at each one and decide what is the best test. Many of you are thinking, well, what about hair analysis? That's a panel that measures a variety of heavy metal and non-metal toxins, for example, like arsenic. But hair is very limited and can lead to erroneous conclusions. Mm-hmm. So in short, I'll say, if a person's hair is graying or dyed, the test is invalid. the level of toxins in the hair could simply reflect the level of toxins that have accumulated from the environment lying down on the hair and complexing with the hair. At the very best, hair will let you know what the toxic level and level of certain minerals the hair has, not necessarily the brain or the thyroid or the small intestine, etc. I will say, in mineral hair analysis defense, that there are a couple of odd health problems and serious diseases where certain toxins or certain mineral levels for that condition are more or less accurate for things. But the bottom line, I would not put all of my eggs in the hair analysis basket.
Okay. Next question. Which toxins are most important and should be tested?
Again, it sounds like a real basic question, what toxins are the most important and should be tested, but the toxin or toxins to be tested depend on the person's health issues. Again, fatigue can be caused from any number of toxins. In fact, almost every toxin I can think of affects the energetics of the cell, the mitochondrial function where energy is produced, and another place called the Krebs cycle in the body. If any toxin can affect those areas and affect energy, how do you know what toxin to do? So the question, if I were to rephrase it, would be, rather than checking the toxins, what else can I have examined by my healthcare provider that would discern where I need to be supported regardless of the different toxins that I'm exposed to? So for example, there are 6 detoxification pathways in the liver. That's it, 6, that we seemingly can deal with hundreds of thousands or maybe even countless millions of toxins in our environment. And evolutionarily, we've developed this way. So the body has these 6 pathways that back each other up to deal with all sorts of toxins. Support those pathways, and you support yourself given a variety of toxin exposure. Sometimes checking those pathways are the primary place to start, and or tests of specific toxins based on our perception of the probability of one or more toxin being the culprit. If someone has a mouthful of amalgam fillings which are 50% mercury, then certainly we would want to check mercury levels in a variety of tissues, and we might, depending on how the detoxification efforts work, check those 6 different pathways in the liver.
Okay. Jumping on to staying with that question, does venous pH or lactic acid pH mean anything with testing for toxins?
Okay. Well, boy, that is another really important question. There is a lot of misunderstanding out there regarding the role of pH, or acid-alkaline balance, health in general, disease propagation, and health building, and of course detoxification. So here's the short answer, and then here's the long answer. The short answer is certain toxins are excreted from the body through the urine or the saliva or the skin, and let's use the urine as an example, only if they are the type that, must be excreted with acid urine, then we need acid in the urine. If the toxin is the type that will only escape with an alkaline urine, then we need to promote an alkaline urine. And urine, by the way, is usually slightly acid normally. So people say to us, they'll say, Mr. Seward, Dr. Wald, I thought we're supposed to be alkaline. Well, I'm not sure what that means, because we should be alkaline in our mouths for the alkaline amylase enzyme to break down starch. We need to be acid in our stomach for protein breakdown. We need to be alkaline in our small intestine through pancreatic secretions in the small intestine. We need to be slightly acid in our large intestine, and somewhere to the right of the 7 pH for our either venous blood or arterial blood. So the answer is, do we need to be acid or alkaline is dependent on where do we need our pH adjusted. If we don't adjust our pHs correctly in different areas of our body, simply put, our bodies don't work well, and we will not detoxify normally. And you mentioned lactic acid. Lactic acid is one of the biomarkers or tests that we measure for general health and well-being, and there is a relationship to toxicity. Many toxins do form acid products in the body, I'll give you that. And lactic acid is one of those measures to see, is that actually happening? And of course, we know that diet strongly impacts our acid-base balance in certain situations. It's very difficult through diet to change blood pH. You can change the pH in the stomach very, very easily with diet. You eat protein. If you eat dense protein, whether it's vegetable protein or whether it's animal protein like a steak, you're going to cause the secretion of stomach acid. And if you constantly eat an acid diet, you'll make a lot of stomach acid, which is composed of HCl, hydrogen, and chloride. And those hydrogen ions that are produced all the time, these elements, they seep through the stomach lining and then they make their way into the blood. So a person would be slightly towards the acidic side, but if you measure their blood pH, it wouldn't necessarily be acidic. Now we work with patients with far-reaching disease and cancer, and they will actually have measurable acidic pH. That's very different from the average walking around person. So that'll be the topic of our pH Q&A. So I want to thank you for listening to this particular conversation on toxicity. I think the takeaway point is that there are many different toxins, but more importantly, it's easy to remove toxins generally, but improving the body's resiliency so that we don't accumulate the toxins is also the key. If you have further questions or would like to get in contact with us at Integrated Medicine in Mount Kisco, you can contact either myself, Dr. Michael Wald, or Mr. Sonny Seward at 914-242-8844, or again, send the emails through the website at www.intmedny.com. Thank you.